A midwife in Ontario is a registered healthcare professional, is a primary healthcare provider who cares for well women, well babies, and we do all of the normal regular prenatal care through your pregnancy, labor and delivery through normal labor and delivery, and we care for newborns and moms for 6 weeks postpartum. The advantages of having a midwife in hospital would be that you know your care provider. You're pretty much guaranteed the person that's going to deliver your baby, going to attend you and your family in labor. Our expertise is in normal, unmedicated, and natural childbirth. So we know when things are going well and when things are going normally. When we need to consult or ask for help, happily it's always available for us at St. Joe's. And then for a lot of people too, once they've had their baby, and if everything has gone well and normally, which is, to be honest, the vast majority of our deliveries, then we also offer them what we call a STAT discharge, or an early discharge from hospital, so that they can have all of the advantages of hospital and be tucked in at home 3 or 4 hours post-delivery. Or they have the option of staying. So they have the option of staying with some nursing care for 24 hours if there are any concerns or any problems. And they've got their own great big rooms, great light, excellent nursing care, and then we would continue with the care with them in their community after that. We have very strict guidelines and parameters for which we would need to consult. Usually our consultations are with obstetricians, and in the vast majority of cases they're the obstetricians that we work with at St. Joe's, who are great. So our advantage is we've got 24-hour, 7-day-a-week obstetric care that we can access. So if our clients need it immediately, we can get that. And if it was a less urgent concern, often our clients would see them in the office of the obstetrician, and then perhaps be followed up by that obstetrician here at St. Joe's. So you would call a midwifery practice. Midwives are funded by catchment, by geographic catchment. So there's usually, especially in the Toronto area, even some overlap for some, but there's a midwifery practice that would be in your catchment. And you would call them, and most people go on a waiting list initially. And it's based on first come, first serve. The nurses here and the doctors here are always super supportive. I can pop my head out in the hall and say, I need some help for 10 minutes, and I always get it. I always get great support and great help. You know, and at the moment now we've got such great space and such big rooms, inviting rooms, big, you know, there's light, there's just, it's much more welcoming in the new space. So I think it's just been a great experience. With the new focus on it being a family birthing center, there's parenting groups for fathers, there's prenatal classes, there's lactation classes, there's postpartum classes for new parents, and the website has really been very succinct in kind of summarizing those. The tours are great. I think that the enthusiasm with which the tours are given and the classes are given about, you know, either prenatal care, postpartum care, caring for your family, caring for your baby, caring for yourself have been great in the last few years.